Fighting the effects of aging is becoming easier with more options than ever. That's the good news. On the flip side, there are so many procedures and topical treatments available, it's difficult to know what is best or where to go for treatment. Here to sort it all out for us is Dr. Ann Stubbs with Dr. Ann Aesthetic Medicine. Dr. Ann, nice to see you. It's so true. There is so much the good news, but there are so many terms, too, that are used, Dr. Ann, that are confusing. So
yes,
hopefully you can clear them up. I've heard things like MediSpa, cosmetic medicine, what you say, aesthetic medicine. Mm-hmm. Can you clear it up for us?
Well, there's a lot of different terms used, and I think we're trying to kind of debunk some of this for people. People come in and kind of don't really know what aesthetic medicine is. And the word aesthetic just means leading toward beauty. So you'll see an esthetician in a spa, perhaps, and that will be somebody who can work on your skin to make it more beautiful. But then you can see a medical esthetician in a doctor's office, say a plastic surgeon's office, or in an office similar to mine that does non-surgical aesthetic medicine. And that is a medical esthetician can look at your skin from a medical standpoint and can use some products and some treatments that can't be used in a general spa because they're under the supervision of a doctor.
So there's a little bit more you can do in your office compared to maybe some regular general spas and products that you can recommend.
Right. There are wonderful, wonderful maintenance treatments that people can do at their general spa, but maybe if they're looking for something that's a little more permanent or long-lasting, that's when you kind of move into aesthetic medicine. And a lot of those folks aren't ready for surgery yet, so they want to do something kind of right in between the general spa. That's kind of the niche for aesthetic medicine. The continuum is kind of the spa, the aesthetic medical office, and then the plastic surgeon's office comes next.
So you're right in the middle, but you still do some treatments, and some can be rather long-lasting. So let's go over some of what you offer that a spa can't offer. Maybe one of those first things, something that has longer-term results.
Well, basically, a lot of times people will go to a spa for say, some work with their eyebrows, waxing, or unwanted hair. That a waxing is something that pulls the hair out from the root and might give you a temporary result with laser hair removal, or even some of the treatments we do with some of the Dysport or Botox. We can affect an eyebrow lift and actually give somebody permanent results of loss of hair in that area if they're struggling with that, and give somebody we're looking at a picture of an eyebrow lift right here, and that's just what we call a chemical eyebrow lift, meaning we relax the muscles around the eyes that pull the eyebrow down.
That
and
is
you can
a big
actually
difference with no cutting or knives or anything.
Right, no knives whatsoever, and that's a result that will last about 4 months, and that's just with some tiny little injections. Patients are usually in and out of the office in about 5 minutes, but I don't think that people really know that Botox and Dysport can be used not just for wrinkles, but actually to lift the eyebrow, which is for women a big thing.
But they are fillers. Some of those other things are fillers.
Yes.
Dermal fillers. Botox is not a filler, though.
Botox is not a filler,
together.
Right. Botox is something that relaxes muscles, and we effectively relax the muscles pulling an eyebrow down, and that's how we get the eyebrow lift. This gal that you're seeing had kind of a dark circle under her eye, and she also felt like she was getting a little bit of hooding or some, sagging around the eyebrow. So we did some Botox and some Dysport around the eye to kind of raise the brow, and then we put some facial fillers underneath the eye there in what's called the tear trough, and we were able to get rid of that dark circle for her.
And part of why you can do some of these things is because you are a physician.
Right. And so these are things that, sometimes people will come in and they'll dump their whole bevy of products out on the counter and say, which one of these works? And there are some great over-the-counter products that do work, but, the likes of Strivectin are not going to give you the same effects as Botox because it's a topical treatment, and some of the fillers and the Botox will actually go into the muscle and actually affect a longer-lasting result.
You also can do some things that really are more permanent results for folks, and part of that is the cool sculpting or the things you do maybe for cellulite treatment.
The battle of the bulge. It's an everlasting one.
There.
And I'll have patients say to me, "Hey, do those wraps at the spa really work?" And some of them do because they've got some caffeine in them, and they might give you a temporary inch loss maybe to get into a dress on a weekend, but it's not going to be permanent. And we're looking now at a picture of a cool sculpting patient who just had the fat freezing around the midsection there. Once those fat cells are cooled and frozen to 31 degrees Fahrenheit, they break open in the body, and the body clears them naturally. And so this is a permanent result. Those fat cells will never come back after they've been frozen. So that's a little more permanent result, still with no knives.
Yeah, and then this one, so something similar.
This is our newest cellulite procedure, and it is effectively, as we know, permanent now. The results are out for 3 years, the studies, then nobody's had a return of their cellulite. And cellulite has plagued women for years, and we've tried everything topical we can on it, and the creams will affect maybe a a little bit of cellulite reduction, but nothing's permanent. The newest treatment is called cellulase. It's a laser treatment right under the skin, and you can see the result before and after here, and that is a permanent result. That dimpling you can effectively get rid of with a little laser right under the skin.
So we've shown many procedures, and many folks may be watching these, Dr. Ann, and not sure what's for them. So you meet with someone with a consultation to see maybe what their comfort level is.
Exactly. Everybody's, you hit the nail on the head there. Everybody's not ready for surgery, and a lot of people just want to kind of dip their toe in and see what's there that might be something they can start for a maintenance. So I usually tell patients to come in for their consultation with all the products they're using on their skin or their problem. So if the cellulite's their problem, they come in with what they're using right now, what's your exercise regimen. We go through all of that and see where they're trying to get to and see if we can find a plan that gets them there effectively and affordably.
Yep. Dr. Ann, it's great. Thanks for clearing up all that stuff for us. Thank you.
Nice to see you.
Happy holidays.
You too.
Thank you, ma'am.